Hi, today I present HR 1193 Cardiovascular Advance in Research and Opportunity Legacy Act. Learning objects include thesis statement, change project idea, legislation, identify stakeholder, prevalence, uh, risk factor, change project implementation, plan and teaching, and change project resource. Thesis statement is increased education and awareness of valvular heart disease risk factor to reduce the incidence of sudden cardiac arrest and sudden cardiac death. HR 1193 Cardiovascular Advance in Research and Opportunity Legacy Act introduced in House on February 22, 2021 and became the public law number 117-244 on December 20, 2022. Research, education, and awareness concerning valvular heart disease and its treatment. This disease is caused by damage to or disease affecting any valve that controls blood flow in the heart. The National Institute of Heart may conduct or support research on the disease in consultation with the National Heart, Lung, and Blood Institute. The NHLBI must also conduct a workshop on mitral valve prolapse, which occurs when the valve between the chamber of the left side of the heart seals improperly. The Department of Health and Human Services must develop best practice to treat valvular heart disease. The Department of Health and Human Services may also carry out other projects to increase education and awareness of the disease. The stakeholder cardiovascular epidemiology and surveillance will continue to enhance the American Heart Association understanding and cardiovascular risk and identify potential areas for intervention at current time and in the future. The collaboration among a group of healthcare professionals can improve our understanding and management of cardiovascular disease. Connecticut Department of Public Health promotes the use of evidence-based strategy to manage high blood pressure, high cholesterol, and diabetes in high-burden population and community through funding from the Center for Disease Control and Prevention. Medical group provider and registered nurse are a support group. They involve to give instruction and provide teaching to improve patient outcome. Payers such as insurance companies decide to cover or not cover medical treatment, medication, or procedure can affect on how and when patients seek medical advice or treatment. Patients are encouraged to seek medical advice to prevent disease, and regulatory bodies set standards include influencing on payer and medical group decision making. Look at the graph. We can see heart disease is the #1 killer in Connecticut. There is 22.8 approximate 7,138 people in Connecticut died from heart disease in 2017. There are estimate 7% of Connecticut adults age of 18 or older. Approximately 198,000 adults had a stroke, heart attack, or coronary heart disease. Heart disease is the first list diagnosis. About 11 of all inpatient hospitalization and the leading cause of death, about 23% of all death. Patients with cardiovascular disease list at the first diagnosis spend 255,000 days in the hospital. The median length of stay was 3 days. Total hospital charge up to $3.3 billion with median charge of approximate $41,000. Cardiovascular disease age mortality rate vary by gender. Rate is higher among male residents compared with female residents. The main risk factor of cardiovascular disease include high blood pressure. According to the CDC, blood pressure is the pressure of blood pushing against the wall of the artery. Too much pressure on the artery can make the artery to weaken and burst, or to become blocked and stopping blood flow. There are an estimated 30.9% of Connecticut adults having high blood pressure. Blood cholesterol is involved in making hormone and digesting fatty food, among other tasks. Too much bad cholesterol, LDL, may build up in artery, blocking blood flow. There are an estimated 34.5% of Connecticut adults having a high cholesterol. Smoking tobacco products are raising triglycerides, lowering good cholesterol HDL, increasing the build of the fat in the blood vessel and causing blood clot. An estimated 12% of Connecticut are current cigarette smokers. Poorly controlled high blood pressure, high cholesterol, and continuous smoking may lead to inpatient hospitalization and death. Besides the main risk factor, disability is also a risk factor of cardiovascular disease. Disability is defined as adults who self-report being blind, being deaf, having serious difficulty in walking or dressing, and limited in any physical or emotional activity. The risk of dying from heart disease may be lower by eating fruit, vegetable, whole grain, yogurt, and nuts. Excessive alcohol consumption may raise blood pressure and increase triglyceride level. Diabetes, obesity, physical inactivity, malnutrition may increase the risk of developing cardiovascular disease. There are 9.6% of Connecticut adults having diabetes, 64.8% having obesity, and 73.9% physical inactivity. Project teaching plan with awareness, though risk factor registered nurse have a crucial role in teaching patients. Nurse at teaching session at the time of hospital discharge result in improved patient clinical outcome, increased self-care, and reduce cost of readmission. Eating healthy, low-fat, high-fiber, low-salt diet, keep ideal weight, control blood pressure and diabetes, take prescribed medication to prevent and stop further health heart-related problem developing. Make appointment and follow-up appointment with the provider. Provider reassure the importance of regular physical activity, healthy diet, weight management, and smoking cessation, which reduce the risk of cardiovascular significantly. Patient consult a primary care provider to get correct information and make right decision. The earlier seeking medical advice, the less cost spending on medical problem. Also, case manager and social work can help patients to work with insurance company with better coverage, reduce barrier seeking medication and medical treatment. We can have some resource. It is clear that we need to understand determinants and pathway of cardiovascular disease early in the life course to improve individual and population health. Epidemiological science has tried health promotion focus on risk-based prevention of cardiovascular disease in all of its forms. Cardiovascular disease risk prediction to allow a healthcare provider to identify intermediate risk individual for early intervention for primary prevention. Popular science using epidemiological and surveillance tools will remain at the forefront in guiding the American Heart Association effort to promote living a longer and healthy life and reduce disability and mortality from cardiovascular disease and stroke. Surveillance approaches and epidemiological study will continue to identify disparity and inequity in health outcome. The data will allow increasing insight into effect of quality improvement program for prevention and treatment of cardiovascular disease across community and healthcare system. Arresting and eliminate persistent disparity and gap in cardiovascular disease and cardiovascular mortality remain significant challenging in current and future to promote justice, reduce the burden of disease, and lower healthcare costs. Research in cardiovascular epidemiology has been crucial in highlighting the impact of social determinants of health on cardiovascular outcome and how SDOH and structural racism perpetuate cardiovascular disparity and mitigate the impact of intervention to lower cardiovascular risk. Epidemiologists must continue to develop gradually to ensure that the American Heart Association can prioritize the most important science for individual health, advocate for appropriate social and health policy, and address the most pressing need in our community to realize the vision of advanced health and hope for diverse population. For recommendation, I feel my change project is really effective if we can collaboration the all stakeholder to awareness a risk factor of cardiovascular disease and prevent that. Randomized clinical trial continue to collect evidence on the effectiveness and safety of intervention for preventing, diagnosing, and treating cardiovascular disease such as percutaneous coronary intervention, coronary artery bypass, using anticoagulation and antihypertensive medication. They have resulted in improved cardiovascular surveillance outcome, insight into the impact of the intervention on specific population or subgroup, and valuable data on cost effective of the intervention. The cost of informal caregiving for patients with cardiovascular disease were estimated to be $61 billion in 2015 and up to $128 billion in 2035. By teaching and increasing awareness, risk factor of cardiovascular disease can reduce the burden of cardiovascular on patients, their caregiver, and healthcare system. And here the reference. Thank you for your listening.